This is the recording for the Occupational English Test, and the test is held at Medcity International Academy, Kannur, on the 10th of May, 2023. The candidate's name is Sangeeta Gopi, and the candidate number is 33456. The interlocutor is Shampanon, and the interlocutor number is 18432. This will be roleplay number 1 for the profession of nursing. Good afternoon, Sangeeta.
Good afternoon.
May I please see your identification?
Sure. Here's my passport.
Thank you. Okay, here you go.
Thank you.
This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally in any situation.
Right.
I will be asking you a series of warm-up questions so that you can get started. This is not in any way assessed. This is just so that we can get to familiarize ourselves with this environment.
Okay.
My first question is, Sangeeta, why did you choose to become a nurse in the first place?
Well, I have an interesting story to that. I was not planning on becoming a nurse. I wanted to do journalism.
Right.
And I wanted to go and give this entrance exam in one of the reputed universities in our country. But my parents didn't allow that, and they wanted me to take up nursing. I did try my best to convince them, but they told me this is the opportunity and I have to take up nursing, and that's how I ended up. But trust me, now I'm really loving this job.
That's great. So what do you think you'll be doing in the next 5 years? Where do you see yourself?
I plan to work in the UK, and I see myself taking up a master's degree there and probably settling down in the UK with my family.
That is wonderful to hear. Now let me redirect you to why you're actually here today. Why did you decide to take the OET?
Well, I did some bit of research on how to get to the UK, that being my dream destination, and I realized that the first step to becoming a registered nurse there is to take up a language test, and OET is quite popular, and that's how I ended up choosing this one.
Okay, we will conclude the warm-up session there, Sangeeta. I hope that you're at ease now.
Yes.
Let's move on to the role play.
Right.
I will be taking the part of the patient or the bystander or any similar role, and you will be taking on the role of the professional here as a nurse.
Right.
The role play will last a total of 5 minutes, and you will be given 3 minutes to prepare for the same.
Great.
The role play, in actuality, intends to get evidence of your ability to perform effective communication with your patients. Okay. Do you have any questions at the moment?
No, I'm clear.
All right. So you will have 3 minutes to prepare for the role play. You can make role play cards. You can make notes on the role play card if you wish to do so. Here is the card.
All right.
And this is a pencil. You can make notes and you can make them as many notes as you want.
Okay.
You can hold on to the card up until you finish the session. After you're done, you'll have to return it to me.
Right.
All right. Okay. So now I will give you 3 minutes to prepare.
Okay.
You can start now.
Right. Thank you.
Yeah.
So how may I address you during the role play?
You can call me David. Okay, Sangeeta, that will be the end of your preparation time. Now we will move on to the actual role play.
All right.
Don't worry if I stop you halfway through it. That just means that your time has ended. Okay? So we will begin now.
Okay. Good morning.
Good morning.
Yeah, I'm Sangeeta. I'm the district nurse in the community health center here. And I'm here today to check on the progress of Mr. David at
Right.
34 Kent Street. Is this the right address?
You come to the right place. I am David.
All right, great. Yes, so Mr. David, from your reports, I know that you've recently had an appendectomy done.
Right.
And it's been almost 2 weeks now. And I've been assigned to check on how well you've been doing after the surgery. So could you tell me how you've been doing?
Well, I haven't been feeling really well for the
okay.
last couple of days. I've been
Okay.
really, really tired. I look and I sound really exhausted most of the time, and it seems that I've lost my appetite. I haven't been eating as much as I usually do, or I generally do.
Right.
I don't know what's wrong with I definitely think there's something wrong with me.
So if I understand right, Mr. David, you feel that something is wrong with you because you've lost your appetite?
Yes.
And you feel really tired.
Yes.
Is that right?
Yeah, that's exactly right. I would have come to the community center myself, but I've been feeling really fatigued, so I couldn't make it there. I'm really glad you're here anyway.
Oh, right, right. So what I can do, Mr. David, is that can I examine you first? Because since you say that you're suffering from
Right.
these problems, I just
Yes.
want to check if there's anything else that I can spot. Would that be fine?
Yeah, that is perfectly fine with me. Go ahead.
All right. So, well, so during the examination, what I found is that you're right. You look really tired and pale, and to be honest, slightly yellowish. So just to get things right here, have you had any other difficulties? Like, have you felt feverish or any pain in the abdomen, swelling, something of that sort?
Well, I'm glad you asked because other than not feeling hungry at all, I have noticed that I've been getting these headaches frequently. And
Okay.
even something that's more concerning is that since the last 2 days, I've noticed my urine, and it's not normal because it's darkly colored.
Right. Okay. All right. So, Mr. David, the symptoms that you've just mentioned, frequent headaches and your urine being dark colored and being, tired, fatigued, all of these are closely associated to the symptoms of jaundice. But it's too early for me to finalize that condition. So
Okay.
I can't confirm yet. I'll need to do a couple of more tests for this.
Okay.
So, like you mentioned that you wanted to come over to the community health center for a checkup.
Right.
I would recommend just that. I would want you to come to the community health center so that we can
Okay.
have a more detailed examination on the same.
Right. Now that you mentioned it, I've also been feeling severe abdominal pain, and I've been vomiting as well.
Okay.
And if you
Alright.
have noticed, you can look at my eyes; they don't look as white. And
Right.
maybe your diagnosis is right. I'm really worried about this diagnosis. What do you think will happen? Will I die?
All right. No. Please relax, Mr. David.
Okay.
I'm sorry for having scared you, with these details. But see, jaundice is not a disease. It's a condition.
Right.
Now, it could mean that you have some problems associated with your liver or the gallbladder. Now, this is just a yellow discoloration of the skin or the mucous membrane.
Right.
And because of the deposition of bile pigments. Okay. So, all we need to do right now, like I mentioned, is come over to the community health center.
Okay.
And we will need to run a couple of tests. Like I said, I can't confirm yet.
Okay.
These symptoms are closely associated with jaundice.
Okay. So, if
yeah.
I may ask, what kind of tests are we talking about here?
Right, I was about to explain just that. I'm glad you asked. We'll do a bilirubin blood test,
Okay.
and we'll also have to do some other tests. I'm sure the doctor will prescribe, certain tests that you need to take up.
Right.
So first we'll go and meet a doctor there, and
perfect.
once we take his advice on what are the tests that you need to undertake, I'll help you with all of those.
Perfect.
So
Okay.
first of all, I would like to ask you to calm down completely.
Okay, I
So
am
you
calm
don't have
now.
to.
Yeah.
Yeah.
So when should I be visiting the community health center? In your
I would
opinion?
definitely recommend that we don't waste.
Okay, Sankita, that is the end of your OET speaking test. You may return the card to me now.
Sure. Thank you.
Thank you.
Medcity International Academy. Trusted hands forever.